So for today, what we wanted to start off the new year with was just getting you up to speed with where we are in terms of DFG consultations, guidance, and all that sort of stuff, because it's going to be a busy year this year, I think, for DFG changes. So as you're hopefully aware by now, in the social care white paper, which came out last autumn, there were a range of announcements around DFG, which followed on from the DFG review, which we did back in 2018, which we'll get onto in a few minutes. But the social care white paper promised consultations on means testing, which would be linked to the kind of wider review of social care charging and kind of the DIL-not cap and those sort of issues that have been in press quite broadly. There'll be a consultation on the upper limit, so that's increasing the amount from £30,000, and also a consultation on the allocations formula. Because you may know that there is a formula that's been used since about 2012, which is based on a BRE publication back in 2011, which came up with a new formula for allocating funding, which has been used to a certain extent since. But the DFG review did recommend that was fully revised and updated. So later this year, there will be a consultation on that as well. But today we're going to mostly talk about the means testing and the upper limits and the kind of issues that you should be aware of from the review, and possibly what will feature in the consultation later this year. And the other thing that was announced in the white paper was that there would be new funding for a minor repairs service. And one of the outcomes of that would be to prevent the need for DFGs by doing minor repairs and adaptations in somebody's home in a timely way. There's no further news on that at this stage, but just to be aware that that's kind of coming, and further details will be announced in due course. The other thing that is pending is new and revised government guidance on how to deliver DFGs. That was due to be published before the end of the last year, but the impacts of kind of social care white paper and those announcements meant it has been pushed back slightly, but that based on a announcement by one of the ministers last week is still due to be published this spring, so that's not too far away. So I'm going to go through the means test first and give you a bit of background and some of the thinking behind what went into the DFG review and how that's fed into the social care white paper. So this is a presentation that we did as part of the consultation into the DFG review back in 2018. In fact, almost exactly 4 years ago, I was sat here writing this presentation. So it's been a little while, but things haven't changed too much in terms of the issues, unfortunately or unfortunately. So in terms of the DFG review, what the government asked us to do, we worked with University of West of England, Ferret and BRE, was that they knew that some people do not qualify, and then they don't then go on to self-fund and adaptation themselves. So they wanted us to look at how the means test operates, the level of eligibility, how many more people might be eligible if something was changed, and then the cost impact of changing the means test. So if you go back to the legislation, which is the Housing Grants Construction Regeneration Act from 1996, pretty much all it says in the legislation is if the financial resources of any person exceed the applicable amount, the amount of any grant shall be reduced. And that's pretty much all it says. But there are quite detailed regulations that then set out how to calculate the financial resources, how to calculate the applicable amount, and when it's assumed the resources don't meet the applicable amount. So basically, financial resources is the total of your income and savings. The applicable amount is how much it's judged that your kind of family or your household need to live on per week. And the kind of assumed resources is the difference between those. So if you earn more than the government thinks that you need to live on as a household, then you would have to contribute something towards the cost of your adaptation. And the regulations go into some detail about what's counted as income, what are counted as assets, what needs are and what outgoings are. But the legislation also says that any other statutory means testing regime could be used rather than having your own specialist DFG means test. So for example, social care means testing regime could be applied to DFG if the regulations so set out. And in terms of the regulations, they're quite long and detailed, but based on some of the documentation that came out in the early 90s describing how it worked, the idea was to target grant aid on the most needy households. I don't think we'd probably put it in those terms today. And it largely mirrors the systems of calculating entitlement to housing benefit, which is, as you may know, is largely being phased out for local housing allowance and universal credit. It allows for passporting for certain specified benefits. That's typically other means tested benefits, means that you're kind of passported through the means to be means tested for DFG. And there's this thing called the loan generation factor. So that if your income is more than the kind of government things you need to live on, they convert that into the amount of the affordable loan, which is your contribution. And none of this takes into account the cost of the works at all. So it's not entirely unusual for somebody to have a contribution of £100,000 for a stair lift, for example, which would obviously cost a fraction of that. That's how the system works. In terms of the data, and again, this data is now a little bit out of date, so it's changed a little. So based on the data from 2016-17, which we used back in 2018, only 14% of approved DFGs had a contribution featured in them. The average contribution was around £1,500. So across the DFG programme, across England, that was worth £9.2 million a year. But then, given that that's kind of the total, there's kind of a question about how much does that just having the means test act as a deterrent for people doing that. So we looked at some of the modelling that the BRE done in terms of the whole population. So if you take the whole population, some of those will live in a care home or a prison. The rest will live in a household. Some of those will have a disability, the rest won't. Some of the people with a disability will require adaptations. Some will already have them done. Some will still need them. Some will then need minor adaptations, but then others will need major adaptations, and some will want to then adapt and some will want to move. So if you kind of segment down the population in terms of those categories, then the means test just applies to this kind of bottom right-hand corner of the chart. And if you take that set of the population and look at their kind of analyse their income and their outgoings, what you come to is that 50% of disabled people who need to adapt wouldn't be eligible for a DFG under the current means test. 43% will get a full grant, and that only kind of the 7% in the middle there make a contribution. So the current means test is kind of pretty much a binary test where for the vast majority of people, you either get a full grant or you get nothing. There are very few people in the middle where there's some sort of contribution to be made. And when we did some more research in terms of the reason why people didn't proceed with the means test, didn't proceed with the grant application, you can see from this chart that the contribution made up kind of 8% of those overall. So 25%, or the rest of the third that didn't proceed, was for some other reason rather than the contribution. So, as I mentioned earlier, that the alternative could be that the Care Act financial assessment is used. These are the principles that sit behind the Care Act's assessment. So I think quite a reasonable set of principles that people aren't charged more than it's reasonably practicable for them to pay. It reduces variation in the way people are assessed and charged. It should be clear and transparent. It should promote well-being, support carers, be person-focused, be applied consistently, encourage and enable those who wish to take up employment to do so, and be sustainable for local authorities in the long term. So there are some differences there compared to the current DFG Means Test. So some of those are kind of particularly around employment. So whereas the DFG Means Test fully takes earnings into account, they're disregarded under the Social Care Means Test. Value of the person's main home is disregarded in both, but probably one of the other main differences is the way that capital is taken into account in the two tests. So for this kind of social care charging, currently, and this may be reviewed as part of the consultation on social care charging, but currently, if you have savings of over 23,250, you don't get any support. And then there's a sliding scale between 14,250 and the 23,250, where you have a kind of a sliding scale of support depending on where your savings fall on that in that region. Whereas obviously with the DFG Means Test, there's a kind of a sliding scale from £6,000 upwards where your where the amount of savings you have is taken into account, but there's no kind of upper ceiling that prevents you from accessing a grant just because you've got over a certain amount of savings. And the other thing that we were kind of thinking about in terms of closer aligning DFG with the Care Act would be if the kind of care cap, assuming that there is a care cap, was incorporated into the DFG system as well, so that if you funded through your own resources adaptations to your home, so for instance, if you funded your own level access shower, then could the cost of that be incorporated within the amount that you would spend on social care in your lifetime under the care cap? And the thinking behind this was that if you've, say, spent £5,000 or £6,000 adapting your bathroom, then you're going to need less social care in the future. So overall, you would spend less and you'd be less likely to reach your care cap. And from the government perspective, that's also a benefit, because if you're not reaching your care cap, then you're still paying for your own care yourself if you facilitate through the means test. So there is potentially a win-win there in terms of aligning the two and having adaptations count towards a care cap, assuming that's part of any proposals that are brought forward later in the year. And the other thing that we were thinking about is, can you justify retaining the existing DFG Means Test? I think it's fair to say that all means testing systems have an inherent level of complication to them, but the DFG one is quite complicated, I think. And is there a justification for retaining a 30-year-old test that's based on housing benefit, that's a benefit that's been disappearing? Very few people still use housing benefit. And as you'll know, the DFG Means Test hasn't been updated since 2008. So that's kind of 14 years without any revisions to it operating because of inflation, for example. So clearly it's kind of an old and kind of outdated test. And is it right that somebody who needs care from a council and somebody who needs an adaptation for a council from potentially the same council should go through a totally separate and different means test that might come out with different outcomes? For instance, we kind of saw cases where kind of a family that had to pay a mortgage and had to pay child maintenance could have a social care means test, which meant they didn't have to pay towards their care. But because neither a mortgage nor child maintenance payments are discounted with the DFG Means Test, they could still potentially have a really large DFG contribution. And so they continue to get free care, even though that kind of could be a saving from adapting the home. So that's kind of a rattle through the arguments that we went through. And then at each of the events, we had an opportunity for people to vote, see what they think. And I'm going to give you that opportunity this afternoon, see if your thoughts as a group are any different to the people from 2018. So the four options I'm going to give you as a chance to vote on are: one, to update the existing. So we would keep the existing DFG Means Test, but with updated figures on the basis that it's kind of tried and relatively trusted, I guess. But remembering it doesn't factor in actual living costs. And as I said earlier, in most cases, you either get a full grant or you get nothing. So option 1 is to retain the existing. Option 2, which could do, is to remove means testing completely, which would obviously be much simpler to operate. And I think you could argue that it'd be kind of preventative, because people have had their home adapted by the state, so it could be preventative for the NHS. But in terms of unlocking latent demand, what would that mean? And how much extra would it cost to do that? And do you believe it's fair to do that? Option 3, again, would be a quite simple option, would just be to use passporting benefits. So if you get a means tested welfare benefit, then you'd be passported to a full grant. And if you weren't, you wouldn't be. Kind of slight complications in terms of how that would work with how universal credits calculated, and what about people on low incomes who don't claim benefits. And then option 4 would be taking the Care Act test, or however that is amended potentially later this year, and using that to as the default means test for DFG, as it brings a direct link to care costs, and it helps to improve that integration with social care. So those are your 4 options, and I will now, if I can find it, launch the poll. Right, thank you. I'll share the results, and by slim majority, well, by majority, it's adopt the Care Act test, which is quite a bit different from 4 years ago, actually, where updating the existing and adopting the Care Act test were fairly even, but retaining and updating the existing definitely seems to have reduced in popularity over the last 4 years, which, as you may have guessed from the way I introduced it, was kind of my thinking as well. So thank you for that. That was really interesting. That was really interesting. Still quite a number of people want to remove means testing completely. I think it kind of bodes well that kind of adopting the Care Act test seems to be the favoured option, which certainly looks like that will be the basis of the consultation later this year. So just picking up on some of the comments from the chat, in terms of the voting, I think went back and looked at the original figures. I think kind of 33% of kind of the audience today are OTs, so relatively representative in terms of the percentage that came to the events before. So I don't think that particularly skews in favour of the Care Act test. I think one of the things that has changed since 2018 is that a lot more local authorities now have a housing assistance or RRO policy and choose not to means test. That would remain the same. So you would still have the option not to means test up to a certain limit if you wanted to. The changes would mostly impact upon the kind of 60% of local authorities that still use the means test for all grants. If you want to find out more about the Care Act means test, we did a webinar on it in May 2020. So either going to our YouTube channel or going to our website, you can find the recording of that and see details of exactly how that might work for a DFG system. And somebody asked about evidence. We've got a new report coming out within the next couple of months that looks at the cost benefit of adaptations, which I think, if I say so myself, is probably the best I've seen so far in terms of making that case. So we didn't write it, we got somebody else to write it for us, but I think it's really powerful in terms of the message that gives. So look out for that in the next couple of months. So the next part of the consultation that is due to happen later this year is around the upper limit. So again, lots of local authorities through their RRO policies already use their discretion to have a higher upper limit. But here's some of the background that you need to know ready for the consultation. So maximum DFG is currently 30,000. Some adaptations cost more than that. So the government asks us to look at where councils use their discretion to pay the extra costs, and is 30k the correct level to deliver value for money, support as many people as possible, and maintain the financial viability of the grant. So the legislation says a couple of things in terms of the upper limit. Firstly, it's an optional thing, so there doesn't have to be an upper limit. And it can either be an amount or it can be a formula. So there is some flexibility there in how it's used. And basically the legislation says an authority may not pay a grant that's more than the maximum amount under the legislation, although, as we said, you can use your discretion to go above that. Looking back at last 30 odd years, when DFG was first introduced back in 1989, there wasn't an upper limit. Local authorities found they were running out of money quite quickly, so a £50,000 upper limit was introduced in 1993. That was reduced to £20,000 in 1994, which then went up to £25,000 in 2002, went up to £30,000 following the previous DFG review back in 2008, and there it has remained ever since. But if you took inflation into account, that doesn't include the current rates of inflation, but back when we did this in 2018, it was roughly equivalent to 38,000, obviously a bit more than that now. So if we look at some of the data, so this is the average number of 30,000 grants per local authority up to 2016-17. As you can see, it's very much the minority. So back then, kind of the average council was doing kind of 80 or 90 grants per year, and kind of doing on average 5. So that's kind of 7 or 8% of grants were at this kind of level. So although they take up a lot of time and take up a fair chunk of the budget in terms of numbers, it's relatively low in terms of the people involved. We also asked about extension costs where they've been funded through a DFG. So for the vast majority of the country, they were around 30,000, which probably means that adaptations were being designed to kind of meet that upper limit of 30,000 rather than necessarily that being the true cost of the kind of ultimate extension. But it had got to the point where that was pretty much impossible in London. So 55,000 was the average. And we did see some examples of where £30,000 had been spent on a kind of DFG and an extension and extensive works. And to a certain extent, in some cases, that was wasted because the adaptation was so compromised that for the sake of an extra £5,000 or £10,000, it could have been so much better and so much more effective for the person living there. Again, in terms of kind of closed inquiries, costs over £30,000 as a reason for a closed case was again very small, so it's kind of 0.5% of cases. And I think kind of the other thing to remember is while £30,000 might seem like a lot of money, that if you look at the relative budgets of different departments or different kind of budget streams from the Department of Health and Social Care, if you look at the kind of DFG budget compared to social services, and particularly compared to the NHS, then you can hardly see the line there. It's so small in comparison. And if you look at other costs, so for example, keeping some kind of an old person in a residential care home can cost up to £70,000. Sorry, with a learning disability could cost up to £70,000. A looked after child can cost over £200,000 a year. And in comparison, kind of the foster care for a child is much cheaper at £33,000. But even then, if you spend kind of £60,000 on adapting the foster parent's home, you spend £100,000 in the first year, as opposed to £210,000 potentially if that child was a looked after child. So looking at some of these in the round and comparing some of the extensive costs that you do get in social care and then in health, then what seem relatively large amounts in DFG kind of pale into significance. And there was a report by University of Leeds that looked at the cost effectiveness of cases, and kind of the students were really, I found it extraordinary that sometimes a grant of £60,000 might be refused, even though the benefit to the public purse was kind of 5 times that. And if you kind of look at it in a more strategic way, that when there's kind of a real squeeze in terms of social care and health costs, then actually this kind of investment in large adaptations can make a real sense across the kind of across the public sector. But there's also obviously also the issue that budgets where they're separate, as a manager, it's your job to stay within that budget. You don't tend to have kind of power to act outside that mandate, and your kind of worth to the organisation is usually based on managing your own budget, not positively impacting somebody else's. So one of the other knock-on effects of increasing the upper limit is around smaller districts in particular. So whereas I think probably kind of the average contribution, kind of the average allocation per local authority is now getting on for 2 million, there are some smaller local authorities where it's in the kind of £200,000-300,000 range. And if then you're having to spend £100,000 on one case, that's kind of potentially a third of your budget, quarter of your budget, which would make a real impact on your ability to deal with all the other cases that you have to deal with. So I think if we're looking at increasing the upper limit, we also do have to consider the kind of some of the smaller districts and whether there needs to be some sort of cost share arrangement across a county that would even out some of these anomalies, or kind of the 1 year where you get a particularly large case. So I'm going to have another vote. So see how this compares to 4 years ago again. So on the upper limit, your options are: 1, there's no change. So on the basis that there's relatively few of these grants, very few fail to proceed, and you can already rely on discretion. So lots of local authorities have kind of a top up or an increased upper limit. And as you've got discretion, you can't say you'll never consider one of these cases. So should you just rely upon using your discretionary powers? Option 2 is to increase the limit. So should we have a nationwide limit of, say, 45,000, which is nice and straightforward all across the country, but then do you need to kind of think about exceptional applications in excess of the new limit? Option 3, remove the limit completely. There's relatively few of these grants. It would definitely speed up delivery. Does that still provide value for money if there's a mandatory duty to provide a grant up to a limitless amount? And would that affect the viability of the grant, particularly for some of the smaller districts? And then option 4 is revise the upper limit, but have a regional weighting on it. So for instance, the upper limit would be higher in London than it would be in the Northeast, for example. And we could kind of set out either regionally, locally, nationally, what that amount would be per area, but it would vary depending on particularly building costs in that particular area. So those are your 4 options. So option 1, stay at 30,000. Option 2, an increased limit nationwide. Option 3, remove the upper limit entirely. Or option 4, use a formula based on a regional weighting. So very little support for retaining the current upper limit at 30,000. Mild support for removing the upper limit completely. And then, so kind of 81% of people want to increase it, and then kind of fairly split between a nationwide formula, a nationwide amount and a regional amount. So again, very, very interesting. I think it'd be interesting to see exactly how that consultation is framed, and what comes out of that in those discussions. So hopefully that gives you an idea of where those 2 bits of work will go later in the year. We'll share those results afterwards as well. So you kind of, I'll compare and contrast them with both the results that we did when we did this again 2 years ago and from 2018.